Okay, so this is a patient who is complaining about pain when she turns her neck to the left. No contraindications, no signs of nerve involvement. So if you show us now, if you turn your head to the left, tell us when you start feeling discomfort.
Right there.
Right there, okay? Now show us to the right. What does that feel like?
Fine.
Yeah, so we can all see the difference here. So let's see if we can regionalize it. So if you turn everything to the right here, and then look straight ahead there, and then slowly turn to your left, and does your neck still hurt?
Right there.
Yeah, so obviously that pain must be coming from the neck and not from the thoracic spine. If we ask her to flex, can you do that? Is that okay? Go as far as you can. So stay there and now turn your head to the left. Is the pain still there?
Yes.
Yes. So obviously that suggests that the pain is coming from somewhere from the upper cervical spine, either occiput, atlas axis, or possible also C2, C3. So let's try to find a way to see if we can find the exact segment. Okay, let's go down in the chair. So let's start from the top. I'm gonna come here and stabilize atlas and try to move occiput without atlas. And she's gonna tell me if the movement that I do produces her pain. So in this case, left rotation. So now I'm stabilizing occiput and I'm turning her. You can see it's just a few degrees here. I do overpressure. Is that painful?
No.
That's not painful. So that kind of rules out occiput atlas if we had overpressure in left rotation. I'm going to go down and I'm going to stabilize C2, and now we're going to test atlas axis. So as we can see, there should be more rotation available. And when I come towards the end there, how is that? Not painful?
No.
I'm gonna, to be sure, go back a little bit, side bend occiput to the right, so C2 rotates to the right, and now we have a much cleaner end range of left rotation of atlas axis. And she says that's not painful. So now let's go down, see if we can find it. I'm gonna stabilize C3 I mean, and now we're gonna move C2, having ruled out OA and AA. So when I come over here, let me know if this reproduces your pain. Right there. So her pain was reproduced by passively moving C2 on C3, and we could not find it at OA or AA. So let's put her down and test C2, C3. So let's try to side bend C2, C3 to the right. And we can see how much side bending here. And is that painful?
No.
Not painful. Let's compare left side bending of C2, C3, where we found the pain to be. And you can see how quickly it stops there. So we have a restriction of down glide or extension of the left C2, C3 facet. Again, compare that to the right, which can, of course, explain why she have a hard time rotating to the left. So let's try to see if we can move this joint and see if we can restore function in it. Because she has pain going to the left, I'm going to do an up glide of C2 on the left to see if we can loosen the joint and gain some down glide and left rotation. So here she is. You okay with that position? Bring her up, walk her out a little bit, take the slack out. Do you have any pain here? And there, and here we go. Put her down, and I'm going to now retest side bending test. So again, first to the right, okay, and now to the left. And as you can see, we gain quite a bit of down glide. So slowly turn to right side first. That was the side that was okay. And back the middle and then to the left. And what does that feel like compared?
More.
More range? How about discomfort wise?
Better.
Better, yeah. So we can see her active range came back, which makes sense now. We saw that the side glide, passive side glide, was restored with the manipulation.